Hey everybody, hope all is well. Let's go ahead and start off with Q&A. So anything goes. So go ahead and let's have your questions.
Hey Greg, it's Robin.
Hey Robin.
How are you doing?
I'm doing good. How have you been?
Good, good. Busy, good.
Good.
I have a question for you.
Mhm.
When I first met you, Heidi gave me a healing session with you. I was having some knee problems, and you looked at me and you said, "Oh, are you getting enough sleep?" And you did whatever magic you do, and I never had a knee problem again.
Oh, good.
Last night, or the night before last, I stayed up very late watching a Netflix series, only got like 4 hours of sleep, and I woke up with a knee problem again. I don't know. So I obviously was exhausted. What is that about?
So a lot of times, first off, what were you watching on Netflix?
I was watching, we do binge watch occasionally. I was watching.
Yeah, of course. It's the best way to watch. Are you kidding?
Mayor of Eastwood.
Huh. I haven't seen it. I'll have to look into
Kate Winslet. It's kind of a...
Oh, yeah. I've seen the commercials.
Yeah.
Okay, so the thing with like muscular issues sometimes, I mean, it could be a whole range of things, but the reason why I said that to you back then is when you're in certain levels of sleep, you start to hit what you call the anabolic state, and it's where your nervous system, immune system, endocrine system kind of reboot, like, you know, they kind of regulate themselves, you know, they reboot themselves a little bit just from the wear and tear of the day. But also what happens is the muscular system also reboots there, and muscles being the skeletal muscle, the smooth muscle of the lungs and the gut, and then the cardiac muscle. And so when you're not hitting deep enough sleep, your body kind of never goes into that repair mode where it kind of reboots and does, you know, some regeneration. And so over a period of time, it just starts to be kind of like you know, you have some appliance and it's just always on and you never turn it off. And you know what I mean? It just starts to be wear and tear. And so ironically, what we're gonna do tonight for the practice was actually going to be the first level of sleep. I planned that a day or two ago. And so, you know, there's a difference between falling asleep and then being able to stay asleep and then hitting those deeper levels of sleep. And usually not hitting the anabolic state is not hitting those deeper levels of sleep. Sometimes it's that you start off poorly, you know, like you're not sleeping the greatest, or you know, you just never hit the deep sleep from the early stages. But you know, a lot of times people are good at hitting the first and second level of sleep, but sometimes those deeper levels of sleep take a lot more deeper relaxation. And, you know, it depends on stress levels and if there's anxiety and if there's pain. You know, pain is another one. And so, yeah, like, are you having problems falling asleep?
I don't think so.
Okay. So there's a section, we'll pull it out and we'll email it to you, that is about hitting the anabolic state. And then the opposite of that is the catabolic state, which is a state of degeneration. And so, you know, they kind of are just like a push-pull thing. Like either you're in an anabolic state or you're in a catabolic state where, you know, you're more prone to activity and action and everything, but that's where you end up degenerating a bit. And so I'll send you that little section. We'll drag and drop and get that to you so you can go through and do that. But if sleep overall is an issue, we might need to do, you know, some of the earlier phases of it. Like we're actually going to do some tonight. Calming down the sensory nerve, relaxation of the muscle, things like that. And so even what we do tonight should probably help.
Okay, great. Yeah, because
and,
it was
and
so,
then if it doesn't, let us know. Like, you know, if it continues for a day or two, like let us know and we can
okay.
up the game, so to speak.
It was so surprising, like, oh my gosh, I remember this.
Yeah.
Yeah, and it was directly in relation to not sleeping, like getting 4 hours of sleep. So.
One of the things that happens also, like if we take it and go further down the rabbit hole, like one of the things that happens, like when there is fatigue or if there's a lot of inflammation, is your body becomes flexor dominant, which means like everything kind of flexes. Like if you were to go into the fetal position, that's all your muscles like flexing. You know, your muscles kind of do a push-pull with things. And so the things that flex bring the joints together and things extend, like, you know, open up the joint. And when you're fatigued and when you have a lot of inflammation in the body, you start to lose muscle tone, you know, even if it's just for like, you know, 6-8 hours, you know, you lose some tone in your body. And the first thing that goes is your extensors, you know, the things that open up the joint. And so over a period of time, what happens is if the extensors don't have tension, then that allows for the things that flex and close down the joint to be like tighter, go into more of a spasm. And so sometimes when you're looking at a knee issue, sometimes it's the quadriceps, especially the lower quadricep and the medial component, which is the inner part of the quadricep, might not have the strength to balance the hamstring. And so the hamstring keeps going into a deeper level of contraction and can throw like how you balance the knee out. Like when that happens, it starts to wear on the back part of the meniscus. And if the medial part, the inner part of the quadricep is like contracted to the point of trigger points, it actually predisposes you to an ACL injury. You know, in super extreme cases, it actually can even cause a rupture. But mostly it's just, it makes you more prone to like tension, tendonitis, tenosynovitis, and, you know, a little bit more potential for, if you were to strain it, there could be a tear. You know, you see it more in athletes than everyday life, but it doesn't mean that going up some stairs or coming down some stairs that it couldn't happen. And so a lot of times what you're trying to do is take some inflammation out of the body and then make sure the body is relatively strong, but then take tension out of that lower hamstring on the back of the lower thigh, and that usually will help knee issues quite substantially. You know, because it's just how that joint. I mean, if you look at the knee compared to other joints, it's kind of almost not even a joint. It's just two bones like on top of each other, where like your shoulder has like a little socket and then the bone fits in there, and your hip has a socket and your bone fits in there. Your knee is just two bones on top of each other that are held together by some ligaments. And so that balance in the thigh muscles actually can play quite a role in knee issues. You know, so, particularly the hamstring, the lower hamstring. It's the bicep femoris, the short and long head usually.
So interesting. So to relieve the tension from the hamstring, you think?
Yeah, you put antispasmodics on it, you know, like marjoram or basil, you know, any of the blends, the antispasmodic blend or spasmophilia, trigger point, any of them should be helpful. Even the pain blends, probably more so the neuropathic pain. Putting it, not quite on the crease of the knee, but like, maybe 3 to 4 inches, like from the crease of the knee, about 3 or 4 inches up, like just across the back. You'll hit both the short head and the long head. Every once in a while, it depends on the kind of knee issue that you have. It also could be like the outside of your thigh, which is the iliotibial band. They call it the IT band. And it's like from your hip all the way down. So that pain will manifest more on the outside of your kneecap or on the side of your knee where the knee bends, but like, in the tissue there. That tends to be a little bit more of a IT band problem. Not so much affecting stability too much on the knee itself, but it does cause like tendonitis and irritation, like climbing stairs or having to like get yourself up and down, from a chair where you have to kind of push yourself up. It could be things like that.
Yeah, this feels more like my knee's going to go out. Like
that is the first thing that I talked about. That's the inner part of your thigh. That's actually so with that, do the back of the knee, like I said, but also do like, so like here, like say this is your kneecap, right? And this is on the front side of your leg, right? This is your kneecap. Like there's this part right up here, that's that quad that you, like if you flex it, you kind of see a little bit of like where it bulges out. That needs to be treated a lot on that front inside of the knee, because that like when that has trigger points, it makes your knee buckle or makes your leg just completely go out from under you. Like it will just do it for no rhyme or reason. Right. Usually there's a little bit of weight bearing on it when it happens. It's not just like you're standing there, but like you're pushing. Like the last case that I treated where somebody had that happen, they were dancing. It was a male. He was dancing and he picked up his girlfriend, like he scooped her up, and apparently she probably only weighs like 100 pounds or something. And so he thought, he's a big guy, no big deal. He scooped her up and his knee completely gave out. And, he basically tore his ACL. So like, that was 100 pounds of pressure. Again, he's athletic and everything, but a lot of times that injury, it's kind of slow and it sneaks up on you. It's like a little bit, and then pretty soon it keeps getting more and more unstable. And so it's really more of a muscular issue than it is a joint issue. And if you treat that inside of the quadricep, that lower section like that, most times that's all you need. You don't need physical therapy or anything. If you just unwind that a bit, it stabilizes that out pretty good. You might need to like really kind of rub and dig your fingers in there a little bit and just kind of poke around. But if you did that every evening for just like 4 or 5 minutes or something while you put on like a good antispasmodic oil of some sort, again, like marjoram, trigger point blend, something like that, you should be able to alleviate that. Like it would be very good self-maintenance, like whenever you start to feel it flare up. But yeah.
Okay, yeah, I've been doing marjoram on the kneecap.
Yeah, so just off to the side, like more to the inner part, and then a little bit up. Like go from the kneecap up about 4 or 5 inches, and then just wrap it around the back to calm down the hamstring. And you should feel relief after the first application. It should be really quick.
So I don't. I was using marjoram then cedar Because at one point, one class you had us doing.
Yeah. That's for lymphatic stuff. Yeah. I mean, that's good to move the lymph in that area, and it would help with unwinding that trigger point. Like if you have the time to do that. But I was even just thinking, just trying to reduce the spasms, like cleaning up that tissue, because that's what you're doing with that. Cleaning up that tissue. If you have the time, that's actually even better. Yeah.
Okay, wow, I really, just even touching it, I feel what you're talking, I feel the tension.
Yeah.
I had no
like
idea.
if you poke around, you'll feel a couple like really, yeah.
I had no idea.
Yeah.
Okay.
And so like if you want to see a picture of the, can I just send you a picture? And
yeah.
Okay. Hold on, and let me pull something up here, and we can do it so everybody can see it. Here we go. Just a sec.
And I'm gonna do a group share, but Robin, I'll send it directly to you as well.
Thank you. And while you're looking at that, I just want to say the class last weekend was over the top.
Oh, good. I'm good, Jim.
Oh my gosh, I went to some dimensions I didn't even know were possible.
Plant prana or to your phone?
Plant prana.
Did you get it?
Mm-hmm. Yeah, I'll share it here.
Yeah, so you can kind of see.
I haven't quite shared it, just so I can share right now. There we go.
Like this is the critical spot for you to treat, like where that little X is. You treat around it even more.
Which X?
The lower one. Well, actually both of them.
So as far as that and that?
Yeah.
Okay.
Yeah.
So I'll do a little like these two. Where my mouse is going around. Okay.
Yeah.
That's great.
If you like, that is the thing that's making your knee buckle, and that is the thing that compromises the ACL. Like you're more prone to an ACL injury with that, and in extreme cases, like there's been cases where you know that spot has been so unstable that it is actually caused the ACL to rupture, and so that's like super extreme. That would usually be like in like a tennis player, or you know, somebody like a soccer player or something, somebody who's running and stopping a lot. But I mean, still, it's like it's a potential for an injury. So like if you knock it out, your knee will feel better, but it will cause the knee to be healthier for a very long time. You know, it stabilizes that ACL.
Yeah, surprisingly tight in those two places.
Yeah. And tender. Like it's usually like your thigh can take a pretty decent amount of pressure, but you get into that inner thigh area down by the knee, and it can get pretty tender pretty quick.
Yeah. Thank you so much. I
Yeah.
so appreciate
And
it.
don't feel you need to do it all at once. You know, just
Okay.
little by little, just keep rubbing it. I'm of the idea that you don't have to irritate it really super bad. You know, just get some pressure on it, get it to release a little bit, and then tomorrow do a little bit more. Like it doesn't have to be this big, like, you know, intense session to release it.
What do you think about using castor oil with
Yeah,
marjoram?
castor oil could be helpful. I mean, you're needing to increase circulation, but it is a trigger point. So you have a little bit of a fascial restriction, some neurological dysfunction because of the trigger point. I mean, that's what trigger points do. And so, you know, that's causing the knee instability, and, you know, that's the neurological components.
How about
And
chamomile oil? Some, you know, those oils.
Yeah, any of that would be good. Castor oil packs would be good, you know, just because it's even the heat and hoping to kind of clean out the muscle. That could be helpful. Putting the oils on, doing hot cold, you know, hot pack on and then ice. That can be a little bit uncomfortable, but still therapeutic. Yeah, it's hard to really stretch that one out. And with a trigger point, stretching doesn't always do it. I mean, there's like stretch and spray things, but you have to use this really cold spray, and you put the body in positions. I would say just doing the movement and putting the oils on and doing the therapy like we've talked about, that should be enough. I mean, most times I was able to wipe it out with that. You know, occasionally, you know, you'd have to do something more intense, but it depends on how chronic it is, like how bad it is based on like also like how long it's been there. You know, a lot of times these have been going on for, you know, 2-3 decades.
Oh,
so,
wow.
You know, it's not something that just happened like in the last, you know, month or two. It's something that's been going on. It just wasn't painful until recently.
Got it.
Yeah.
All right, then. So to work.
Okay. Thanks
Thank you.
Yeah, let us know if it doesn't work.
Okay.
Go ahead, Tracy.
Hey, Miss Tracy.
Hello.
Hey.
So I don't know what's going on today, but yesterday I dropped my phone, broke it, and today has been the worst communication issues I've had. And like, I can't seem to get anything accomplished, like no phone calls, no texts.
Yeah.
Emails are going.
I think there's an astrological thing. Like, I'm not one to like to throw stuff into that, but Thursday's supposed to be a pretty funky day and we're getting close to it. It could be astrological.
Well, it makes me want to stay in my, like, it makes me want to stay inside and just disconnect from everybody and say, I can't help you.
Well, I find when you are having days like that where, you know, it's like dropping things are just going wrong, like just slowing things down, taking some deep breaths. Like when you get up, make sure your feet, like let yourself be centered with your feet before you start walking. It just helps you to like stay like balanced and centered in the middle of, because sometimes it's the environment, sometimes it's people, sometimes there are astrological things. Sometimes it could be that you didn't feel good. You could be processing something from a dream, you know, which sometimes goes on hours into your day. You know, there's all kinds of things. And so like whenever that starts to happen to me, I just slow everything down. I start taking longer, slow, deep breaths. Like if I'm sitting and it's time for me to stand, I think about standing and then I get up and I let my feet be under me for a good like 15-20 seconds. And then I start walking. Where in the old days, I'd get kind of caught up in that feeling, and I just start going kind of fast and I bump into things. And like you said, like drop things or just you start getting wound up a little bit. And so if I just slow everything down, even if things are going weird, I can catch it. I can catch myself. I can catch what's going on. And so it's just something that usually passes, but you don't want to get too sucked up into it's not quite like an automatic behavior, but it's just like your body's getting wound up and you're just pumping the brakes for it. It doesn't mean that crappy things still might not happen. It's just slowing it down takes the intensity down a couple notches. Yeah.
Thank you. I've been thinking about my mailbox from this past weekend's class. Mm-hmm. And like, usually things are metaphors for me. And for that, it's like, well, check is in the mail, or you just have to wait because the universe isn't ready to give you that. So you have to wait like you do for the mail, because
that's an interesting way.
USPS is very slow right now, and it drives me crazy. So all this today was kind of like,
I think it drives you crazy.
Yeah. So it feels like it has to do with that. Like I'm trying to.
That could be. Yeah.
Okay. Thank you.
Yeah. Try doing the thing though where you just give yourself like 15-20 seconds to get your feet under you, like when you stand or get up. Or
I will.
I find it quite helpful for myself.
Hyssop decumbens is my friend.
Yeah, hyssop, large.
Okay.
Sitka, all of those would be good.
Okay, thank you.
Yeah.
Go ahead, Barbara.
Hey there.
Hey.
A couple of questions, and then I want to bring it back to the sleep piece.
Okay.
One, Samantha's magical neck thing you mentioned, I forgot what it was, but I could sure use it. You mentioned it a week or so ago.
What was it? What were we talking about?
Warming muscle tonic.
Yep.
Oh, warming muscle tonic. Yeah.
Ah, okay. Thank you.
Tracy, I noticed you knew that one right off. Oh.
It's my favorite. And by the way, it's not on the website.
Oh, it is. I need to send you the links. I also got price updates for you for the large bottle.
Perfect. Thank you.
Yeah.
Okay. I wanted to ask, I have been feeling a lot of different sensations in my right hand recently. Some of it's itchy, which I presume is expelling, but sometimes it's more tingly. And I don't know how to tell what's going on.
That's probably not expelling. That's probably you got either in the shoulder girdle or the back of the neck. There's probably some sort of compression. In the shoulder, the nerves come down and there's like a muscle that kind of goes over it. And if that shoulder is real tight up in here, it will compress the nerve. Usually when it's that, well, I guess the other way too. I was going to say you'd see a little bit of puffiness in the thumb web. It's like it kind of puffs up.
Oh yeah, there's a little there.
Yeah. That I mean, it still could be the neck, but a lot of times that's a shoulder issue because that muscle is also going over a vein, and so you don't get quite the blood return in that arm that is normal. I mean, it's not horrible. It's just it's compressing a nerve, and so when there's a moderate amount of pressure on a nerve, it excites the nerve. So you get like twitching, you could get like itching, you could get, it's usually that, like it's like little quick spasms or little flutterings or like the itchiness. And then as gets worse, actually the sensations go away because it's actually starting to go asleep. Right. And so when you're getting the fluttering and stuff, it means you have a moderate amount of pressure. And so a moderate amount of pressure, usually in my mind, is more of an entrapment than an impingement. And an entrapment is soft tissue, like, compressing the nerve. An impingement is like when it's like bone and cartilage pushing on the nerve. It's more substantial. Usually you lose, you don't feel pain, but you're starting to lose like muscle mass, and you're not getting proper nerve flow to that area. I mean, puffiness down in the thumb web could happen with that, but with what you're describing, I'd probably, I'd still treat the neck, but I'd probably treat the shoulder girdle more, like especially like in here, and then on the side. Yeah, like that's actually probably where your issue is. Like if you had a therapist evaluating it, like if you lift your arm up like this, and somebody holds your arm and then takes your pulse, it's one of the ways to check to see if it's like an outlet syndrome, where it's so compressed that like when you elevate your arm, your blood, basically the blood stops flowing to your hand, like to and from your hand, not completely, but kind of substantially. And so that would be more a shoulder girdle issue rather than a neck issue.
Okay.
Based on your symptoms, I would treat it as I would still put stuff on the neck, but treat the shoulder girdle. Like, just, pain relief, neuropathic pain would probably be the better choice, especially on the neck. You could actually, if your skin can handle it, you could actually even put it on neat on your neck. And one of the things about the pain relief neuropathic is when you put it on the spine, it helps to relax the spinal muscles and the spinal cord. There's the fascia that wraps around the spinal cord, and sometimes what happens is because of all the wear and tear on the spine itself, that tissue can go into a spasm, as well as it's just fascia, but it still has an impact like a tight muscle would. And it's compressing a little bit, like more like putting pressure on the spinal nerves. Mm-hmm. And so by putting the neuropathic, the pain relief neuropathic, it loosens up that fascia, and it loosens up the spinal muscles that go between, the vertebrae. Right. So it takes pressure off of the spine and the spinal, the vertebrae, because you're opening things up. And so if you do that and inhale like hyssop or hyssop decumbens or something, which relaxes the diaphragm, you get a 1-2 punch for relaxing the spine and opening up the spinal nerves. And then whatever you treat here becomes a little bit easier, because you always want to open up the spine anytime you're treating almost anything. You kind of always want to treat the spine. But regular applications to the shoulder, in the front and on the side, a little bit in the back to wherever you can get, but it's more about the front side, and it's a little bit deeper. Like if you dig your fingers in, like right in the crease and then right under the collarbone, you'll notice that like if you go kind of deep in there, there's like a muscle that's a little bit wider than your finger that you can kind of almost like move your finger and like pluck, like you're plucking a guitar string. You can kind of feel that, and that's the issue. Like that muscle right there is the issue. Yeah.
Yep, I can feel it relate to my neck. Okay.
Yeah. It's called the pectoralis minor. It's not the big chest muscle. It's this
Right.
this little tiny one that almost looks like a tendon.
Thanks.
Yeah, you're so welcome. Like try treating that like that, and within, like, I'd give it like 4 or 5 days if it's not feeling like it's on the upward swing, you know, because it might take a little while. Depends on like how long it's been there and why it's there, you know. Could be an injury, could be a misalignment, could to be like a little bit of a muscle imbalance. But like right off the bat, let's just have you do this. And once you start to get relief, we'll probably put you on a thing for doing treating muscle imbalances. And you know, that would just be, again, another topical thing right there, and it should help balance that out. But let's get it unwound first.
Thank you.
Yeah, you're so
So the sleep,
very common shoulder issue, by the way. Very common.
the sleep piece feels like a silly question, but you were talking earlier about getting deep sleep. And it's like, how do you know that you're getting deep sleep, except for, you know, you're not?
Yeah, well, I mean, if you're waking up rested, that's usually a good sign that you're getting, you know, a certain amount of hours. Like I'd say at least 6 or 7, but you know, for a long time I lived on just 5 hours. But you know, a good 6, 7 hours is good. You know, 8 is awesome, but
So if you're getting 6 or 7, you can assume that some of it is deep sleep.
If you're waking up and you're feeling pretty rested, I'd say yeah. If you're waking up and you're not always rested, you're probably not hitting it every night. If you're constantly waking up tired, something's going on with your sleep.
Okay, yeah, it's not constant. It's periodic.
Yeah, from time to time. Yeah. And sometimes, you know, the issue, like, I'll use myself, for example, you know, there's times where I have a little bit of a hard time sleeping, but I have like nerve damage in my leg. And if I treat the nerve damage and calm it down, all of a sudden I sleep like a baby. You know, so like if you're in pain, it usually throws off your sleep a little bit. So if you're having a night where you're achy and something, just by treating the pain usually improves the quality of your sleep.
Okay.
Yeah. Like if you're in pain, your body's like in low grade, like fight flight, and your body just won't ever like completely relax. I mean, that's the thing. When people have chronic pain, within 30 days, they're moving from acute to chronic. And then shortly after that, I give it another 30 days or so, and they're usually moving their way towards a sleep issue. And then eventually it turns into a sleep disorder. You know, it's, you know, it could just be like insomnia or teeth grinding, you know, all those are sleep disorders. But I mean, there's about 30, 35 sleep disorders that could be associated with a pain syndrome.
Okay, thank you.
Yeah, you're so welcome.
Someone asks, what oils would you recommend for someone with a new diagnosis of femoral hernia?
Femoral hernia, wow. Honestly, the with a hernia, the best thing you can do actually is not even an essential oil. The best thing you can do is, you know, for obviously you're following the thing from your doctor where you're not exerting, so that's going to compromise the hernia. But if you 2 to 3 times a day apply a substantial amount of castor oil to the area of the hernia, it actually sometimes can help close the hernia up somewhat. It doesn't usually close it up completely, but I've seen several times where it closed it up about 70 to 80%, which can make it, you know, very manageable, or, you know, manageable until you can have, you know, depends on how bad it is, your procedure. But you know, the person who actually turned me on to that was actually a surgeon. Like he said, you know, sometimes he just has his patients do this, and it's enough to either make the surgery, you know, very, very minimal, or sometimes it just becomes non-surgical. So like castor oil, like just, you know, 2 to 3 times a day if you can, you know, at least twice, morning and night. My experience is it's been helpful. You know, it doesn't help every time, but it helps substantially. Like, you know, 7 out of 10 times I'd say it probably helps. So give that a shot. There's no oil that really will help that other than for like pain management and things like that. But the castor oil should be helpful.
Go ahead, Kathy.
Hey, Kathy.
I have a friend who has apparently a sprained ankle. She doesn't remember doing anything to it, but she went to urgent care and they said they just think it's a sprained ankle. I told her to soak it in Epsom salts. I gave her margarine oil, and I said,
perfect.
Soak it
You did perfect.
Put margarine oil on it.
Yeah.
And I don't know if there's anything else I could give her.
Okay, so she's just feeling it like in her ankle. She's feeling it along the side of her lower leg. Like, where is she feeling?
Mostly the ankle. She hasn't been walking on it much. It's quite painful, and she doesn't remember doing anything at all.
Is it across the front, or is it down by the side, like the bottom of where the ankle bone sticks out?
You know, I didn't really ask her because
they x-rayed it though, yeah?
Well, apparently not at urgent care. I thought that was weird because what if she broke something or, you know?
Yeah, I mean, if she really wrenched the ankle, the concern is, like, you know, you have you have the big bone that comes down in your leg, and then you have this other little tiny bone called the fibula that comes down, and then they hit the ankle. And sometimes when you roll the ankle, you know, like you roll it out like that, like if this was my foot, you roll it out like that, there's a little bit of pain that happens underneath the ankle bone, and that is a place where there's a potential for fracture. That's usually like a ligament can tear in that area, but you know, if she really wrenched her ankle, that would be the concern. And like that, you gotta have an X-ray, like to really.
Yeah, I was thinking it was.
If they didn't,
X-ray.
If they didn't think it was that bad, you know, you nailed it. Like Epsom salt, like soak it in that, rub marjoram all over it, rub the marjoram up along the shin bone as well, like with ankle roll, like a sprain. The shin is heavily impacted, and like even to the direct like side of the leg, there's these kind of long thin muscles that run there. Those can be impacted too, but it's usually more the shin bone. So I would just treat both. You can just rub marjoram on that area directly, and that should kind of resolve it, like unless there's something else going on. Now, with the pain, and if something's not healing very fast, one of the things that we do, especially with soft tissue injuries, is we give like 2 to 3 drops of black cumin at least once a day, if not twice a day, like maybe the first day or two, like once a day. Yeah, it's for the inflammation, and it really kind of helps stimulate the healing process in the body. And then the other thing is we give them galbanum, about two drops, you know, at least once a day, again, possibly twice a day. And that helps take the edge off of the pain, and it takes a tension out of the body that is because of the pain. Like if you said to the person, do you have tension in your body? They'd go, no. And you give them galbanum, and then they'd go, oh, I didn't realize I had tension until it was gone. Like, it's not like it's this excessive amount, but it's like it's a pain body response. You know, it's your body goes in pain. It just kind of tenses up to protect itself. And you really don't realize it's there until it's, you know, it seeps away. And so, I do that.
Couple drops in water twice a day, or?
Yeah. And so if they're not wanting to do that, still the marjoram is pretty solid. Like that's super, super solid.
So she'd be open to do other things. I just wasn't sure to tell her to do.
Yeah. And if it looks inflamed, you could always do, you know, you're doing the black cumin, but in more extreme cases, I have them use, I'd say like this. If she's not getting better, like within 4 or 5 days, I'd probably put her on some sort of anti-inflammatory, which would not necessarily be, I mean, the black cumin will probably knock it out. But if it needs to be augmented, you know, there's oils that could work, but sometimes I like to go at it with using a digestive enzyme between the meals, you know, not with your meal, but between the meals. And it's basically like a natural way of doing ibuprofen. You know,
well, you know, one time you recommended that Wobazine.
Exactly. That's I'd give her enough for like 10 days and she'd probably be fine.
Wobazine. Okay.
Yeah.
Now, when you mentioned the Gelbman, I'm just because I'm the one with the facial pain.
Oh, yeah.
Should I be taking that?
Any type of pain, I always suggest it. You know, like I have torn muscles in my back, and like when they start to flare up, man, I'm chugging galbanum like nobody's business.
Okay. Yeah, it sounded like something I could use when you were just.
Yeah. I mean, it's just it just takes the edge off of everything, and like even though you might be using, you know, ibuprofen or, you know, pain meds or whatever, it makes them way more effective because of what it does. And that black cumin and galbanum combination, it's ironic. They don't work as well together, but when you take them separately, they work really good together. They work really, really good together. Yeah.
I take black cumin myself, although I'll give it to her to try.
Yeah. 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 Yeah, I try to take black cumin daily. Every once in a while I forget, but.
Now, when I actually, now that another question, because I take Pomarosa,
Sure.
black cumin, ANS, a couple drops in water.
Yeah.
Are those always done separately within like 5 minutes?
Yeah, within 5 minutes. That's good. Yeah, it's best to do them all separately though.
Okay.
Yeah.
And if I do the galbanum black cumin, is that a further distance apart or still?
Yeah, I mean, you could like wait a little bit, you know, it's just because, you know, that's a decent amount of oil. So like maybe wait a couple hours and then do a 1-2 thing with them, or, you know, however, but yeah. If your system can handle it, you can handle it. But like at first, I try to ease people into it, you know, because essential oils are super potent. And so I like to just try to let people's system adjust and adapt. You know, if they can handle it, fine. But if not, just slow down the application. Yeah.
Okay, thank you.
Mm-hmm. Yeah, and let me know how that works for the face and stuff.
Yeah, I'll definitely. I think I have to order some galbanum. I have about everything else, but
yeah.
For the question referring to the hernia, how long would you need to apply the castor oil?
Like you just rub it in like lotion?
Oh, okay, maybe that's the question.
Is that what you...
So for how long would I need to apply the castor oil for 2 to 3 times a day?
Oh, it's hard to say, but it's probably going to be a couple months. I mean, it's not going to like just fix it like boom, boom. It's a bit of a slow process.
Question. I've been using rue topically and inhaling to relieve myself of cords at work. When my RO web is filled with cords, anything else I can do? They said chakra webs. I'm thinking maybe they're talking protective webs.
Yeah, so
if I diffuse that at work.
That or hyssop. Like I would do one of those. If you're finding that you need to try something a little bit different, there is tansy, not the blue tansy, but just regular, the Idaho tansy. That can be helpful as well. But I would probably just do the rue and the hyssop. Like in the workplace, I'd probably do the hyssop and then use the rue to clean up. The hyssop will diminish the negative interactions between everybody's energy body. Like it just calms all the back and forth, you know, because part of what happens in those kinds of settings is you know, emotionally, mentally, you might not be stressed out. You know, you might, but even if you're not, the wear and tear of what's happening, everybody's body can get agitated and their emotion might be completely calm and feeling normal, but the bodies are interacting with each other energetically, and you know, they're sending signals, and you know, just, you know, things bounce back and forth without us even knowing it. Things get projected without even us knowing it. You know, it's part of the immune response, the nervous system, how it's processing things. And so hyssop calms that down. Rue is a good thing to clean up with. Tansy would be a good one to clean up with.
I'm going to the dentist later this week or early next week for a root canal. What are the best oils for the mouth, and what's a good protocol to dissipate anxiety about the dentist?
So the root canal, I would start, you could do a couple of things. Okay, so one, if you're wanting to open up the lymph nodes for the mouth and the throat, an oil that's really good that helps keeps everything, you know, reducing inflammation through opening up the lymph nodes is bay laurel. Bay laurel is also good for a very wide variety of bacteria, you know, including like strep and staph, and I mean, it's just good for the throat, good for the mouth. But as far as the tooth itself, for reducing infection, reducing pain, is clove oil. Clove is super, super good for teeth health. Like, you know, it's a good pain reliever. It's a super strong antibacterial. It can numb the teeth pain out, can help with abscesses, you know, can help with all kinds of things. And so that should help you maintain. As far as anxiety is concerned, still thinking this out for a second. I would try taking the oil for kava. I would try a few drops, like 3 drops of that. And then if in 15, 20 minutes you're still feeling a little bit anxious, still take another 2 or 3 drops. That should really knock it down. I mean, you could also do something like ginger lily or rose. I don't know so much for anxiety. Tuberose maybe. Neroli and Melissa. Neroli and Melissa mix really well with kava. But the kava should knock it out. I mean, there's always like things like spikenard and marjoram, but you're talking about such a higher level of anxiety, and you can always try deepening your breath with like hyssop or sitka larch, but you probably need something stronger because of, you know, you're going in and having this thing, it gives you something to think about, and so it's probably more about that. So try using the kava, like 2-3 drops in water, or, you know, just on the tongue, and then wash it down. And then after 15 minutes or so, if it's still up, then do another couple of drops. Yeah.
As for using the bay laurel or the clove, what is the application? How is it
So
taken?
the bay laurel, you could take a couple drops internally, but the bay laurel probably is best in that manner by, you know, getting a little glass like that's like maybe 1/3 full of hot water, And you could put like a little tiny pinch of salt in there and then just like swish it around in the mouth or like gargle with it. And then don't swallow it, just spit it out. The clove oil, either with your finger or putting it on a Q-tip. I mean, it is a little bit hot, a little caustic. And so you might want to just like soak a Q-tip and then get it in and around the tooth that is going to have the root canal that is pain or you know, has the infection. And just really hit all around the tooth as much as possible. And that should help at least reduce the pain until the time of the root canal. You know, would help reduce the infection too, but I mean, still with teeth, it's a weird thing because it gets under the teeth and then, like, it can do weird things. And so,
what oil can I use to help with the pain radiating around my hip, especially at night and when I walk? Marjoram only works for a short time.
So it's a sharp stabbing pain, or it's like a dull achy, like an achiness.
Achy from the hernia.
Oh, it's from the hernia. Oh, that makes it a little complicated, the hernia. You know what I would actually probably do is I would use, you know, you're going to be putting the castor oil on it, but I would use probably like joint relief or things that are good for like arthritic conditions, because it's not quite that it's arthritis, but you're looking at something where you're wanting to decrease spasms, you're wanting to detoxify that area, and you're wanting some pain relief. And some of that is, you have a, you know, basically that hernia is like a wound that's not closing. It's not a skin wound, but it's still like an open spot. And so you're wanting to increase blood supply. And so that's pretty much what the arthritic formulas kind of do. I mean, some of them, like ArthriCare, does things more about deposits, but joint relief is more about, you know, moving out the lymph, increasing blood supply, reducing spasms, you know, the things, you know, reducing pain. And I think that would be actually a better application. And so, you know, you could put several drops in like a tablespoon of oil and then just rub it in and around the area. Or if you're wanting to do the castor oil and the joint relief at the same time, you can make the joint relief into a liniment, you know, alcohol based, and rub it on, let it dry, and then put the castor oil on. Actually, you could even just mix it into the castor oil. Yeah, like normally I would say no to that, but for this situation, I think it's totally fine. Yeah. And so if you don't have joint relief, it's basically a combination. I mean, it's a more complicated than what I'm going to say, but like it's rosemary, Sylvester pine, dwarf pine, and like juniper or cedar, you know, something like that. We put both in, but we add some like ginger and stuff like that. But even if you just did those three things, rosemary, one of the pines, and like either a juniper or cedar, it should start bringing relief pretty quickly. You know, you might have to do it multiple times a day because it's probably lymphatically pretty congested from the hernia. You know, the tissue around it is probably, you know, backed up lymphatically. And so you'll probably need to do it more often at first. And then as time goes by, it should decrease quite substantially. Okay. Yeah. And if you have questions, like start off trying to do that. And if you have questions, shoot us an email.
And then if you want any more questions, otherwise I think we're ready to go on to protocol.
Okay, we're going to do the protocol. So let's see here. So we have that. Okay, so interesting that we were talking about sleep because over the weekend I was like, we're going to do a segment out of the sleep class. So I said it in that voice too, but we're going to start right off the bat with actually falling asleep and getting good quality sleep just on the initial movement and moving towards sleep in the very beginning. So one of the very first things that needs to happen is, you know how like when you lay down, you don't want a lot of noise, you want the lights off, you want the air to be not too hot, not too cold, you have these things that you're looking for. And basically what you're doing is you're soothing the sensory nerve input that is going to the brain, because if there's a lot of sensory information coming, your brain or part of the nervous system actually gets hyperstimulated. And so it becomes really hard to unwind at night. And so this is actually an issue with chronic fatigue syndrome and fibromyalgia. The sensory nerves are firing at such a rapid rate that they're firing at like 5 to 10 times potentially more than normal. And it's not because of inflammation or anything, it's just the nerves are overstimulated. And so what happens is so much information goes to the brain that the brain is constantly having to process it. And it's like if you're at work and all of a sudden you have 5 to 10 times the amount of work in the same work time. At some point, you get tired and you start, breaking down. And so that's what happens is eventually it causes brain fatigue. And so then brain fatigue starts to cause a whole nother problem. And how the sensory nerves fire more rapidly is usually because of stagnant lymph. Like when your lymph is stagnant, your lymphatic system is not flowing like it should, or it's backed up. It actually directly causes the sensory nerves to start firing at a more rapid rate. And so that's why the lymphatic component was included in the sleep class, because so much of our overall health is tied to lymphatic function, and we really don't think about it very much. And this is one of those points where if the body is lymphatically stagnant, your nerves are firing at a much more rapid rate. There's just no way around it. So with that, lots of different forms of all the different kinds of hyssop, including decumbens. You can actually even use the Solomon's hyssop if you'd like. Hyssop supreme is really good. And then also tarragon. Tarragon is another one that's really super good for this. And so again, this is to calm sensory nerves. One of the ones that I've used that I didn't list here, you might want to play with it if you've had this class a few times, is vetiver. Vetiver sometimes actually works quite well for this. Okay, so begin inhaling. Your awareness is on your front solar plexus, the area below your ribs. then just be still for a second. Just let it go. Begin inhaling again, still on your front solar plexus. Just long, slow, deep breath. Move to your back solar plexus, your mid-back area. Your front spleen on the left-hand side below the ribs. Left-hand side below your ribs. The back spleen, directly opposite of where you're at, on the back side. In your navel. An inch and a half below the navel. The bottom of your tailbone. bottom of your tailbone. The soles of your feet. Just be still. Beware. Just be still. Let's do it again. Front solar plexus, long, slow, deep breath. Your back solar plexus, your mid-back area. Your front spleen on the left-hand side below the ribs. The back spleen, opposite where you're at on the back. The navel. Inch and a half below the navel. Bottom of the tailbone. the soles of your feet. Just be still, be aware. Just be still. You can still use your hyssop. You can use Keep Snowbush. You could also use Sitka. If you're feeling fancy, you can use aloes. Also the angel corneal, if you want to use an angel. Now, this is to help calm down and relax smooth muscle, which is your gut and your respiratory tract, skeletal muscle, which is all, you know, your physical muscles that move your body, and then the cardiac muscle. One that's not here that we could add is neroli. Neroli can actually work. Okay. So begin inhaling. Your awareness is on your brain. Move your awareness to your lungs. Move your awareness to the liver on the right-hand side, below your ribs. Move your awareness a little bit more to the midline, still slightly off to the right, still just below your ribs. Long, slow, deep breath. Your kidneys. Your awareness is on your kidneys. your spleen on the left-hand side below the ribs. The navel. An inch and a half below the navel. The bottom of your tailbone. Just be still. Now, take some more long, slow, deep breaths, but go to the most uncomfortable part of your body and just take some long, slow, deep breaths. If there's pain, if there's just tension, if it's achy, if it's something that bothers you during the day, just go to the center of the part of your body that bothers you the most and just take some long, slow, deep breaths. And just be still for a moment. Just let it sink in. Again, put your attention awareness on just some part of your body where there's tension and just inhale. Take several long, slow, deep breaths. And just be still. Okay, let's have maybe a little bit of feedback. I know we only have a couple minutes.
You can unmute yourself, you can type in.
Yeah, we just probably have time for one or two, but let's just see how you feel. This is only half of a segment. This is parts 1 and 2. There's still 3 and 4. It's the third segment in the sleep memory class. But usually even this one segment will really improve sleep.
Yeah, go ahead, Marianne.
Hey, Marianne.
I was having an awful lot of pain in my right shoulder, which does interfere with my sleep each night. And after doing this, I'm not having much pain there at all.
Good. That's perfect.
Relief.
Yeah. I mean, part of what we just did was, you know, we are relaxing that part of your body so that, you know, potentially it doesn't keep you up at night. And
Yeah.
so, you know, like I get like these little twinges in my leg, and if they're happening at night, I barely sleep. But if it's calm, I sleep like a baby, you know. And so, you know, pain is a real disruptor of sleep. And so.
Yeah. Thank you.
You're so welcome. Okay, so I think we need to.
Yeah, it's time.
Yeah, we got to jump into the angel class. So sorry about that, but we'll pick up with this next week, and we'll do the rest of the sleep component after the Q&A. But right now we're going to jump on into the angel study group. So
love for you to join us.
Yeah, feel free.
Right,
it's open to everybody.
Next on the newsletter, next link.
Yeah. So love you guys. Take care.